December 16th, 1773. Please remember that date, December 16th, 1773. Does anyone remember what happened on that date? In Boston. 3 tea ships had arrived in Boston Harbor, carrying tea owned by the British East India Company. The British East India Company had a surplus of no less than 17 million pounds of tea. So Parliament passed the Tea Act to bail them out with reduced prices and tariffs, which undercut our own merchants and tea companies. The citizens of Boston were already boycotting tea and took serious exception to this additional outrage. The royal governor, however, refused the public demand to send these 3 ships back to England.
Well, happy 4th of July weekend to everyone. What a great turnout today. You know, someone called me the other day and they said that they thought that these tea parties were anti-government. And I said, no, they're not anti-government, but they're for good government. And that is one thing that we've heard a lot about on the federal level, but let me tell you, it reflects on the local level also. You know, what do they expect in their elected officials and local elected officials too? And there is not one day that goes by that I don't stop and think who I work for, who elected me, and more importantly, whose money I'm spending, because it's not mine.
She refused kidney transplants from her children and has accommodated her life to ongoing dialysis treatments. She runs a support center for people on dialysis, giving encouragement, support, and a little political savvy to her group. In short, Virginia stands tall among American liberals. So imagine her shock at the following conversation with Joe Bureaucrat. This will require some acting. You stand tall among American liberals. Bring, bring.
Hello.
Hello, Virginia. This is Joe Bureaucrat from the Government Office of Health Management. I'm an advanced care planning consultant.
Oh, hi. How's it going? What's up?
Well, actually, it's your time that's up.
What do you mean my time's up?
Virginia, you supported and lobbied for the President's health care reform bill. We are grateful for all you did. The President personally asked me to thank you for all the wonderful work you've done promoting his election and his agenda.
Well, okay. You're welcome. Is that it?
No, Virginia, we have to discuss your deteriorating health and make plans for your exit.
My exit? What are you talking about?
Obamacare, the new law says an advanced care planning consultant, that's me, will be used frequently as a patient's health deteriorates.
Are you nuts? I'm in fine health. I get dialysis and all my lab results are great. I had a stress test, which I passed with flying colors. Get out of my face.
Virginia, didn't you read the healthcare reform legislation? The plan you promoted mandates my role as your advanced care planning consultant. We need to work together on a power of attorney, a living will, and, well, the new law says advanced care consultation may include an order for end-of-life plans.
That death panel stuff was removed from the legislation.
And now, see, that was the beauty of the Obamacare bill. Nobody knew exactly what was in that legislation. Remember how Speaker Pelosi said Congress had to pass the bill in order to find out what was in it? That nasty term, death panel, does not appear in the new law, but the new law does include advanced care planning and comparative medicine boards to assist citizens with their end-of-life decisions.
I'm calling my doctor, you creep.
Virginia, Obamacare says the government will specify which doctors can write an end-of-life order. The government will decide what level of treatment you will have at the end of your life.
I'm going to call AARP and all my congressmen. One of them is a Republican.
Yeah, you're just being testy, Virginia. AARP and endorsed this plan, and so did your Democratic congressman, thanks to your effective lobbying. Again, thank you.
AARP endorsed this? I'll sue them.
Virginia, stop whining. You got cheaper airfares, great vacation breaks, and car insurance. You're not making this easy.
Easy? You braying jackass? I should make it easy for you to kill me? What medical credentials do you have?
Virginia, the numbers speak for themselves. You use 47.9 kilowatts per hospital visit at a rate of 7 to 6 on an annualized basis of 44 square units per liter. You are stealing medical care from kids in Broken Bow, Nebraska at a rate of 27 cellugens per day. 1 Virginia equals 3 Broken Bow kids. Don't you know simple math?
I was a math major, and you are talking gibberish, you Ivy League pencil pusher.
Virginia, as Dr. Jack Kevorkian says, to everything there is a season, a time to live and a time to die.
King Solomon said that in the Bible, you ignorant twit. I'm hanging up.
You have no choice, Virginia. In a few hours, our end-of-life counselor will visit you to discuss the end-of-life arrangements. By the way, we will pay for your funeral.
This is a nightmare. It's like the Nazis.
Virginia, only Speaker Pelosi is allowed to make those kinds of comparisons. Anyone else who does it is a foaming at the mouth, white, right-wing, extremist, racist hate monger. Virginia, you don't want to be any of those things.
2 words. Drop dead.
Exactly! That's the spirit! Now you're getting on board like the true patriot you are. The end-of-life counselor should be there soon. Goodbye, Virginia.
As I said, I'm 73 and I have caller ID. Thank God.
The end.
Thanks, Wells. Thank you, Chip and family, for being